Hello, my name is Dr. Randall Kahan, and I am the President and CEO at Woman Care, which is a very large healthcare organization offering comprehensive care to the women of the northwest suburbs of Chicago. I also serve as the director of the very new Center for Bladder Health and Pelvic Organ Prolapse at Northwest Community Hospital in Arlington Heights, Illinois. During the past 30 years, I have developed an interest and cultivated an expertise in treating all types of problems related to the pelvic floor. These primarily include problems with urinary incontinence and pelvic organ prolapse. Today, I'd like to introduce a video that discusses a problem that affects over 3.5 million women in this country, pelvic organ prolapse. As you watch this video, it's my sincere hope that you find some information that will help guide you and help inform you more about the problems that you may be experiencing. And as you watch this video, please remember two things. Number one, if you do have problems related to your pelvic floor, you are not alone. And number two, help is just around the corner. All you need to do is ask.
Have you ever had a feeling of heaviness in the pelvic region? Vaginal pain, pressure, or bulging? The feeling of sitting on a ball? Difficulty urinating, or having a bowel movement? If so, you may be experiencing something called pelvic organ prolapse, and you are not alone. Approximately 3.5 million women in the U.S. suffer from pelvic organ prolapse. Half of all women between ages 50 and 79 say they experience symptoms. Many women experience symptoms of pelvic organ prolapse during normal daily activities. Pelvic organ prolapse occurs when the group of muscles that support the bladder and bowel become too weak or stretched and cause the bladder, rectum, bowel, or uterus to descend into the vaginal wall. There are several types of pelvic organ prolapse. The two most common are called cystocele and rectocele. A cystocele, or anterior prolapse, occurs when the supporting tissues of the bladder weaken and cause the bladder to descend into the vaginal wall. A rectocele, or posterior prolapse, occurs when the supporting tissues of the rectum become weak and cause the rectum to descend into the vaginal wall. Either of these conditions can feel like a bulge, pressure, or heaviness in the vagina. Some common causes of pelvic organ prolapse include childbirth, menopause, excessive weight, and frequent constipation. Remember, pelvic organ prolapse is a common condition that can be treated. Be sure to talk to a specialist to ensure you find the treatment that's right for you.
Thank you for taking the time to learn about pelvic organ prolapse. I encourage you to learn more at femalepelvicsolutions.com. On this website, there is a wealth of information on pelvic organ prolapse and another common condition in women, bladder leakage. On any of the pages, you can click on Find a Specialist to find a physician in your area that specializes in treating these conditions. Thanks again for your time.